Hi guys, some of the most talked about medications in history, semaglutide and tirzepatide, also known by the brand names Ozempic and Wegovy, Mounjaro, often used for weight loss, but also they have several unexpected benefits. Here with more information is your MD Bestie, Dr. Jaya Sharma.
Hi there. Hi, how you doing?
You're always so colorful and pretty.
Oh, good.
You look great.
Well, I tried to bring it today, give a little.
It was a gloomy day, so thank you for bringing the sunshine.
Absolutely.
Let's talk about it. So these drugs that are meant for, not originally for weight loss, but it turns out for weight loss, also have other benefits.
Yeah, I feel like everyone knows the brand names Ozempic and Mounjaro because they've really been the game changers for helping people lose weight. Initially developed as medications for people with diabetes. But what I've been seeing clinically are benefits that have nothing to do with weight loss. And actually what we're doing at your MD Bestie now is because we're using these medications off-label, meaning they weren't specifically designated for these purposes, we are actually able to use semaglutide and tirzepatide for things that you would never have expected. So one of the biggest things that I've been seeing is the reduction of pain from arthritis.
How cool.
And I even have patients who don't need to lose weight at all. They don't have the desire to lose weight, but they have lots of joint pain, inflammation, swelling, and maybe it's not from just osteoarthritis, but rheumatoid arthritis, fibromyalgia. There's a lot of conditions that cause chronic pain and inflammation where you just wake up with pain and you go to bed with pain.
How interesting.
And so I have been doing a low dose of the medications, not at a weight loss dose, and been dosing them every 2 weeks instead of every week. And we get a dramatic reduction in their pain.
That's
which
so
their
interesting.
Quality of life is so much better because they're not taking Mobic or Advil or narcotics for their pain. Instead, they're taking a medication that's actually making them metabolically healthier from the inside out.
Well, how interesting. So I didn't realize that you could actually play with the dosage amount and get different benefits depending on what your problems are.
Absolutely. And like a lot of my evidence is quote unquote anecdotal, but I'm in a lot of doctor groups online and we're all seeing the same thing. So I fully expected the studies to corroborate what we're seeing. But it's not just a reduction in pain from arthritis. I have people who reversed fatty liver disease, reversed it, which is insane. Also, if you have a strong history of stroke, heart attack, dementia in your family, I've actually been using it for the prevention of those things. And again, not for weight loss, but for prevention so that you can have a good quality of life. And I even have one patient that I started using it who does have early onset dementia, and we've been actually able to improve her overall memory and give her more time with her family where she knows who she is and is her regular personality just by using semaglutide low dose every 2 weeks.
Well, and I will admit I take tirzepatide.
Yeah, me too.
I take I guess a reasonable dose. It's 500 milligrams or whatever.
Yeah, 5 milligrams.
5 milligrams.
Yeah.
And that curbs my appetite. It does help me with weight loss, but it makes me feel so much better.
It is,
I find I don't have as much brain fog, and I just generally am in a better mood.
Absolutely, and especially people and women who are like 35 and older, like both of us are, we at some point are having our hormones mess with us, right? And these medicines are stabilizing the insulin hormone, which guess what? Stabilizes the sex hormones like estrogen, progesterone, testosterone. So it just doesn't just help with weight loss, but it helps with how your body is working overall. It's like taking your entire body for an oil change, but you look prettier and skinnier the next day.
Well, it's astonishing how many drugs they're finding out have multiple uses across different platforms. And all of these can really be beneficial. So number one, they need to come to you and they need to get a panel done.
Yes, absolutely. You need to come see me at your MD Bestie, 318-777-JAYA. That's Jaya. And then I will do everything. I will take your history, we'll order lab, we'll see where your markers are. And the most exciting part of that is that every 3 to 6 months, we get to see how much healthier you're becoming. And your primary care provider is just gonna be in love with your results, I promise you.
Right, and if you have all these problems, and people tend to dismiss women's complaints because they say you're just being hysterical.
Yes.
Hopefully some of that's going away, but you're always gonna have some of that. And
we're still fighting it.
For someone to be able to say it's legit, things are happening in your body, and maybe there's a fix for it, is game changing.
Absolutely, and what we're able to do thanks to our partner pharmacy Boudreaux's in Lake Charles is we don't have to apply for insurance to approve these things for these indications. I can evaluate you myself, and you and I can make the decision together about what's best for you and your life, and we don't have to wait for a pharmaceutical company or an insurance to tell us yes.
Right, with a cool monthly membership to MD
Absolutely,
Bestie.
yeah. Please subscribe and I can take care of you every month, no problem.
Excellent. All right, yourmdbestie.com. Check it out today. Thanks so much, Dr. Jaya.
Thank you, Susan.